My name is Dr. Yakub from Well-Life Hospital, Abuja. Today we'll be talking about menopause. A reason being that in practice, we see a lot of women who come to us after they have attained menopause and they're going through a series of symptoms that they're not aware that it is actually menopause. And after they've gone from one hospital to the other, unfortunately, sometimes in certain places they're not able to be appropriately diagnosed. So we believe that giving some level of information on menopause will help every woman navigate the path through menopause itself. So we're going to talk about menopause, and before I go further, I will give a little background on why menopause in women comes about. Of course, sometimes people also ask us, do men go through menopause too? Now, there is a basic physiological or anatomical difference between man and woman that makes women go into menopause, but men don't go into menopause. And that basic structural or anatomical or physiological process is the fact that the way God created women, He created them such that at the point of birth, the woman has a fixed number of eggs, basically. And so as she goes through her life, the eggs diminish and diminish in numbers to a point that at some certain point in her life, the eggs get completely exhausted. And it is at that point that technically she enters into menopause. Men, on the other hand, don't have that. Usually men are created to produce new sperms all through their lifetime up until death. And so men don't technically have that situation we call menopause as it occurs in women. So what is menopause? Technically, as I said, the background will help us understand what it is all about. Basically, menopause is that point a woman gets into in life when her menstruation ceases completely. In other words, the menses stops. But before we make a diagnosis of menopause, we say that the menses would have stopped for at least 1 year. Before that time comes, most women will experience what we call climacteric, which is the irregularity of the periods. They will come, miss for some months, then come again, like that and like that, until ultimately the period stops. Now, usually when it stops, and it stops for a whole year, then we say that yes, the woman has entered into menopause. So the diagnosis of menopause is actually very simple and straightforward. It is mostly what we call clinical. Clinical means you don't need to do laboratory tests to make a diagnosis of menopause. Now, what is the average age at which menopause occurs? In different societies and in different times in human history, menopausal age seems to change depending on the society the woman finds herself in. But on the average, we say that it is usually between the ages of 45 to 55. That is the period of life in a woman when menopause comes in or sets in. So the average age, the range is 45 to 55, but the average age is about 50. Some places 51, thereabout. So majority of the women in life will experience menopause in this age group. Of course, in life, just like every other thing, there are people who are the outliers, people who may experience menopause much later in life, or some a little bit earlier in life. But generally speaking, when a woman experiences menopause before the age of 40, that condition is considered as premature ovarian failure. We don't see that as menopause. Rather, it is considered that the ovaries rather failed prematurely for various reasons. So many reasons may contribute to that. But as I said before, menopause comes physiologically at about 50 years of age. It's important for every woman to have this at the back of her mind, because The age at menopause, it's important, especially when a woman talks about childbearing. That is when menopause is relevant. It's important for every woman to know that after menopause, almost always, technically speaking, that woman may not be able to have her own biological child or children, as it were, because her eggs, as it were, are exhausted. So if she wants to have children after menopause, in most cases, the children will have to come through a process of IVF with someone else being donated to her to have the child. So that is basically what it's all about. Now, what are the causes of menopause, or how do women go into menopause? Of course, the first thing I mentioned before is aging itself, the age. As a woman grows older, ultimately she will get to that age when she will enter into menopause. And that process, that natural menopausal process, is called physiological menopause. That is what every woman goes through in life. Sooner or later, you will go through that process. Once you get to, even for those whose menopause is delayed for whatever reason, ultimately, perhaps by the age of 60, it's rarely seen where a woman is above 60 and still menstruating. It's very, very rare. I won't say it's not seen, but sometimes. Most women by the age of 55, they have entered into menopause. So that's the physiological menopause. There are other situations where women go into menopause for different reasons, and these reasons are called, in most cases, probably from some form of medical intervention here and there, or the woman is accidentally exposed to certain situations in life that have destroyed her ovaries, and such situations will create earlier menopause. So there's this non-physiological or non-natural menopausal states that a woman may enter into. So there are two categories of that. One category is where we call surgical procedures. Some people, some ladies undergo surgeries for some health reasons, especially gynecological reasons. And by that process, sometimes the ovaries are removed. Okay? There is this thing, sometimes women who have fear of probably developing breast cancers in life, or ovarian cancer in life, or endometrial cancer, some hormone sensitive cancers, and maybe from their family they know that yes, they have these risk factors, or certain tests have been done and they're told that they have these risk factors. So on their own, because they know that the ovaries are the storehouse of those hormones that can predispose them to these cancers, they electively go to remove the ovaries, especially if in their own assessment they feel they have completed childbearing, or they don't even need children for fear of getting into that situation. So they go and opt to remove their ovaries. Of course, once the ovaries are removed, the woman has automatically entered into menopause, basically. So that is surgical menopause. There's another form of menopause that may set in when a woman undergoes some kind of medical treatment. Sometimes young ladies find themselves having certain cancers which are considered sometimes hormone sensitive. Things like breast cancer, sometimes even cancers like colon cancers. Some cancers, anyway, that may require that the woman or the lady undergoes chemotherapy. Chemotherapy is drugs therapy that are meant to kill cancer cells. Now, usually one of the side effects of chemotherapy is unintentional, is the fact that rapidly dividing cells, as we call them, especially in the ovaries, are destroyed by chemotherapy. That's accidental. That's a side effect that is not desired, but there's no way you can isolate the woman's ovary from her body when she's going through chemotherapy. So the ovaries get exposed to these chemotherapeutic agents, and ultimately sometimes the ovaries get destroyed in the process, and the woman will end up getting into menopause prematurely. So sometimes we have that medical menopause setting in, and the woman goes into menopause. So we have this situation where a woman is exposed to sometimes radiation. If a lady has some kind of cancer that may require her getting exposed to radiotherapy, radiation, especially where the radiotherapy is focused at her pelvic area, that is where the ovaries are situated. Let's say a woman has, let's say maybe colon cancer, for instance. This is not directly related to her reproductive organs, but because the ovaries are very close to the colon, that is the intestinal part, the part of the intestines that is deep inside the lower part of the tummy where the ovaries are located, and she's while exposing the cancer to radiotherapy, the ovaries by the sides are inadvertently exposed to radiotherapy, and sometimes the ovaries can get damaged, and in that case she goes into menopause. So in medicine, in medical therapies, there are some kind of what we call fertility preservation surgeries, whereby in some situations the woman is advised to undergo a surgery where the ovaries are removed from that place where they may be exposed to radiotherapy, and then they are placed somewhere else in the body far away from the pelvic area, so that for some reasons her fertility may be preserved. But it's not everywhere that we have facility for this, but it's important that people are aware that this is available in case any young woman or young lady finds herself having to go through radiotherapy. She has that option of saying, oh, can my ovaries be shifted to another place, so that, because I want to preserve my fertility. So those options are available. But by and large, I mentioned physiological menopause, I mentioned surgical menopause, where operation is done and the ovaries are removed for whatever reasons. I also mentioned medical menopause, where the woman is exposed to medications or radiotherapy, and then the ovaries are destroyed, and so therefore the woman goes into menopause. Now, what are the ways the woman knows that she's going into menopause? In other words, what does the woman feel, or how does she feel? In other words, what we call the symptoms of menopause. There are myriads of issues, but one thing I can say clearly is that most women go into menopause and they get really distressed, because some or most of the menopausal symptoms are very distressing to the woman, and there's practically no organ in the human body, in the woman's body, that's not affected by menopause. Practically every system in her, from her skin to her bones, are all affected by menopause. Now, the central reason why this happens is the fact that the ovaries, usually when they're very functional, they produce a hormone called estrogen, which is actually the central hormone that controls a woman's femininity, so to say, including her looks, including everything else about her, including emotions and all of that. So when this hormone when it diminishes in quantity, or when the ovaries stop producing it, of course the woman goes into some very drastic changes that she experiences, and those things actually tell a lot. I mean takes a lot of toll on her. Now there's this very common thing, we call them vasomotor symptoms. Vasomotor symptoms in the marketplace, we call them hot flushes, or some call them hot flashes. For most women, that's actually the first signals they feel. And what happens in most cases is that the woman finds herself feeling really hot, just as the name suggests, even in the midst or in the presence of, when other persons are probably complaining of cold, she just had this breakouts in sweat, she feels very hot, and all of that all over her body. And sometimes in the night, the first thing the woman was just experiences is excessive night sweat. She just goes through this. Even when there is AC, she sees herself helplessly sweating, and that comes in flashes, comes for few seconds or few minutes and then disappears. So for most women who experience menopause suddenly, that's the first signal they see. But majority of times there are subtle symptoms that they go through or without knowing that these are menopausal symptoms. So, like I said earlier, before menopause sets in, usually it takes a while. It doesn't come suddenly to a woman, but it takes a little while. During that, it will last 1 year before the menstruations, the periods eventually stop. They'll be experiencing some things related to the declining estrogen hormone level. Some of these things include things like mood swings. For instance, a woman just finds herself helplessly having mood swings and she doesn't understand what's happening. In fact, sometimes the woman goes through bone, muscle pains, repeatedly treating malaria and typhoid all over the place without knowing that actually it is menopausal symptoms that are setting in. And sometimes they find themselves they're not able to sleep at night. Now suddenly you just see that before then you were able to sleep normally, but then suddenly you find it difficult to sleep. Or you find sometimes you just get depressed. You're not happy with yourself without really knowing what exactly is going on, and you get very irritable and all of that. So these are some of the what we call psychological symptoms of menopause that can set in. So for women who find themselves in this, experiencing some of these symptoms, especially where they are in their late 40s or early 50s, and especially where this is associated with menstrual irregularities, it may be appropriate to approach a professional who will educate you properly on what you're going through, after excluding other things. In our own practice, we've seen a lot of women who go through these things and have been subjected to several medical examinations and investigations, and the doctors don't seem to know what's going on. But ultimately, when you listen and you go through their history properly, you realize that it is actually perimenopausal or menopausal symptoms. And it gives a woman a lot of relief, at least having the diagnosis first and knowing that yes, indeed, this is what is happening and it's a natural process. And sometimes that in itself is reassuring. Some of the other symptoms that may come up with menopause regarding her skin, sometimes the woman's skin just gets dry, wrinkles and all of that. And then in the genitourinary tract, of course, usually the woman also experiences a lot of dryness down there, and sometimes they even experience pain while urinating, because again, the urinary tract where urine passes, urine is a bit acidic, and so once urine passes through the urethra, which is the mucosa, the lining is dry, she experiences pain. And sometimes what they go through is just urinary frequency, and they become more susceptible to frequency in urinary tract infections because the protective barriers are distorted because of low estrogen levels. So some of these things are things that we see women coming down with. And of course, generally, one of the other things that affect even their sexuality is affected, because ultimately, once the estrogen levels are low, the woman experiences very low or no libido at all, and that in itself can be very distressing. Now, how do we manage menopause? Because menopause is largely physiological, as I said, majority of women go through it is because it's a natural phenomenon, it's a natural process of life itself. So in itself, we start by educating and telling them, yes, it's a natural process. Ultimately, your body adapts and you get used to it. However, when menopausal symptoms, most of them, when they become very distressing, or when they begin to affect the woman's quality of life, maybe work and every other thing, the symptoms are interfering with this, sometimes we give them a little of those hormones or that particular hormone that we know is largely responsible, or the absence of which we know is largely responsible for the menopause. So this is called hormone replacement therapy, HRT for short. But before a woman is qualified, or before a woman is given hormone replacement therapy, usually there are a couple of things, there are a couple of concerns we have. Now, when you are interfering with nature per se, because you know that menopause is a natural process, you know that when you begin to interfere and you want to reverse the woman's natural process, there's this concern of, are you going to create problems for her, or is it nice? So there's a fear behind the science. There's a theoretical fear, even in medical cycles, that perhaps you may be exposing this woman to maybe occurrence of some cancers. The number one in the list of those cancers that theoretically people are afraid of is breast cancer, because the reason for that is that some breast cancers are hormone sensitive to the extent that estrogen itself that we say the ovaries produce to maintain woman's femininity, the absence of which eventually creates all the menopausal symptoms, it is one big hormone that is responsible for breast growth and development. So when some cancers, breast cancers, are diagnosed, the treatment of that breast cancer sometimes involves removing estrogen from the woman. So that deprives the breast cancer from that hormone, and in some cases the breast cancer goes. So therefore, conversely, it therefore means that if you're exposing a woman to that hormone now in her menopausal state, and supposing she already has breast cancer coming up, and you are now feeding her, by nature she had already escaped, because she has gone into menopause, she probably has escaped the stimulation effect of that hormone. Now you are replacing it. So there's a theoretical risk that perhaps you are going to wake up things that probably have gone to sleep. And so there's that risk factor, that you may wake up sleeping dogs, as they say. And so you don't want to do that. So there's that theoretical risk for which hormone replacement therapy is feared. Again, there's another type of cancer, endometrial cancer, that's also largely hormone dependent. That is cancer of the lining of the womb itself, not cervical cancer. Cancer of cervix is the neck of the womb cancer. That's a very common one. But there's another type that may affect the inside of the womb itself. We call it endometrium. Okay, and that endometrium, it's actually driven, its growth and development is usually driven by the presence of estrogens. So if you are replacing estrogens in a woman who is already menopausal, the lining of the womb has already dried up, and then you are replacing estrogen, there's a risk of waking up something that has gone to sleep, as I said before, and maybe there's a theoretical risk of transforming it into cancer. So for these fears, for these concerns, hormone replacement therapy is not available, it's not done across board for every woman. So there's usually a selection process, and before you do that, you want to let the woman know that yes, while I'm trying to alleviate your menopausal symptoms, I may be pushing you towards this risk. So at the end of the day, it is a woman's responsibility to choose having and being properly counseled on the risks and benefits of that hormone replacement therapy. She has the right to take an informed decision on this. After all, at the end of the day, it is her life. So our role as doctors or physicians will be to guide her and let her know that yes, indeed you have these risk factors. It's not been proven clearly, but then if she chooses to go through the hormone replacement therapy, then it's up to her. So usually it's a very simple therapy. In fact, in most cases, it's very simple drug. But I would advise that people avail themselves with the right professionals before. They should avoid self-medications in this regard, because if you have a risk factor for cancers and you do hormone replacement therapy, perhaps you're going to push yourself out into that path, which is not appropriate. So by and large, menopause, it's a physiological condition. Every woman who is alive up until that age will eventually develop menopause sooner or later, and it's important to know that it's a natural process. You go through it knowing that eventually your body may adapt to it. Now there are certain non-pharmacological or non-medical ways of managing it, including physical exercises, things that have been shown to improve the woman's situation around menopause. Physical exercise seems to help a lot of women go through menopausal symptoms. There are certain things also that tend to worsen menopausal symptoms. Things like obesity. When a woman is obese, in most cases that's overweight or obese, in most cases menopausal symptoms are worse. So weight loss can help you go through menopausal symptoms better. Now, there are other herbal things that we hear. So generally, so I said plant-based things, but plants that have what we call phytoestrogens, that is plant estrogens, they also tend to help women go through menopausal symptoms. And then antioxidants, in certain vitamins, vitamin E and the rest of them, they tend to help women go through menopausal symptoms. But by and large, if you think you are in this age group and you are experiencing any or one of those things that we mentioned earlier, it will be appropriate that you go to the appropriate professionals. They will guide you through menopause, and perhaps you will go through it smiling. So thank you very much.